Good evening, everyone, whoever is logged in into this webinar, and a very beautiful interaction we are going to have, a very useful one और very powerful one. और इस वेबिनार में आप सभी लोगों ने लॉग इन करके अटेंड करने का डिसाइड किया है, तो इसके लिए आप सभी लोगों के लिए हार्दिक स्वागत. And good morning to all the people from USA who have logged in from various parts of USA. So now, today we are almost at the fag end of 2023. Today is 18th of December. Only a few days left. I'm sure there are a lot of preparations going on for Christmas, for New Year, and ending the calendar year with a lot of energy, a lot of josh, a lot of targets in every sphere of our life. So today we are going to talk about a very very important subject. एक ऐसा subject है जो हम सभी लोगों को भारतीय होके गर्व होना चाहिए, and that is our ancient wisdom of Ayurveda. But at the same time, the same Ayurveda has been modernized and in a way, technologically advanced and developed, and many of the elements of Ayurveda are also reflected in this new science of genetics. So we in this webinar are going to talk about as to what is the correlation of these two sciences, the ancient wisdom, which has been used not only by Indians now, but I think it's now more popular outside of India because people are now unearthing the beautiful benefits of this, proven science. So we have a very very special person, with us today, all the way from USA. She's already live with us. She's already joined, and all of you are extremely lucky to listen to her live because she has a huge, a list of credentials and achievements in her illustrious health and wellness specialist life. She's she is definitely from India. By the name, you can definitely make out. But she's somebody who is now settled in USA, and she's a medical doctor. MBBS doctor. But after seeing the MBBS syllabus, curriculum, and the way of the medicine being, prescribed to the customers, or I would say the patients, she also switched her, uh, you know, uh, expertise into the ancient wisdom of Ayurveda, and now she has seen both worlds of, medical, the allopathic prescription medicine, and at the same time the benefits of Ayurveda. So she is now not only settled in the USA, but then traveling to a lot of countries, a lot of African countries, European countries, and she's been awarded with so many prestigious awards, and she has been helpful in treating the ailments of many people across the world. And whenever she visits India, a lot of people are waiting as to when we can go and meet her and take her appointment. So we have a very, very eminent personality with us. She also happens to be the advisory board member of Velocity Genetics. So I would like to welcome Dr. Sumita Prajapati here. Dr. Sumita Prajapati को आपने इसके पहले भी सुना है, and you all have benefited. So, Dr. Sumita Prajapati, good morning to you and a warm welcome.
Good morning, sir.
So it's nice to have you here once again. कभी भी हम लोग डॉक्टर सुमिता को रिक्वेस्ट करते हैं कि आपके जो आयुर्वेद के जो एक्सपर्टीज है, वो पूरा आयुर्वेद का जो प्रैक्टिस है, या उनका जो भी एंशियंट विजडम के स्क्रिप्चर्स हैं, उसका सब पे एक निचोड़ हमको एक घंटे के अंदर अंदर आप उसको हमको बता दें, बिकॉज वी ऑल रिक्वायर कांस्टेंट रिमाइंडर्स. वी ऑल रिक्वायर कांस्टेंट a system where we cannot go out of the subject. So she keeps telling us as to what we need to understand. So today we are going to talk about the fundamentals of Ayurveda. A lot of references she will give you to authenticate the claims, and she will also then relate as to how Ayurgenomics, genomics, और इसमें क्या common चीजें हैं. So over to you, Dr. Sumita. The screen is all yours, so you can kindly enlighten us. And at the end, if there are some questions, we'll allow some question and answer session as well for some minutes. So over to you.
Yes. Thank you so much, Stan sir. Thanks a lot for inviting me again and again and again. And I really enjoy all the invitations from you, and I try to prepare as much as I can. So today also I have prepared lots of slides for you all people about genetics and Ayurgenomics. But before I start, I just want to correct you a little bit. I don't have an MBBS degree, but I have done a course which is for 8.5 years. It's a combined integrated course where we learn allopath as well as Ayurveda.
Okay, I
So
stand
it's
corrected there.
we have to give examination for physiology and Sharir Kriya both, anatomy and Sharir Rachna both, pharmacology and Dravya Gun Vigyan also. So we learn both together in a same science, and it's called MD in Ayurveda. I have done MD in Ayurveda, and my special subject was diabetes. So I've done my MD in diabetes subject. So just a little correction. Sorry about that.
No, I definitely stand corrected. I mean, I'm sorry for that.
Yes. So as soon as you told me about the Ayurveda and genomics, I started thinking, about Ayurveda. When we study Ayurveda, we have a chapter in Charak Samhita. Do you know about Rishi Charaka? So there are many different samhitas in Ayurveda, like many rishis have written different of their different opinion about Ayurveda and different things about human beings or all living beings in their grantha or in their books. So there is one book called Charak Samhita. In Charak Samhita, Charak Rishi has written about genetics 5,000 years back. And 5,000 years back, he written exactly whatever we are seeing nowadays in genetics. Exactly each and everything. I'll tell you with the shlokas what Rishi Charak has mentioned in Charak Samhita, Sharirasthan, chapter number 3. So in chapter number 3, Rishi Charak has recorded a conversation between two scholars of Ayurveda, Atreya and Agnivesh. So when Atreya and Agnivesh were talking about genetics, they were asking questions and they were getting answers. And those questions and answers are written in Charak Samhita as it is I'm going to share with you today. Okay? So are you all ready?
Yes, all of us are ready.
Yes. So what is Ayurveda? In simple word, Ayurveda is a combination of two words, Ayu and Veda. Ayu means life and Veda means science. So it's literally a science of life, which will tell you how to live better and healthier life and also a longer life. Like we see people who live long, but their quality of life is not good. Like they suffer from diabetes, cholesterol, blood pressure and whatnot, until they die, they are on the bed and their quality of life is not good. But Ayurveda says in Kali Yuga, we should live at least for 100 years with full health, energy, enthusiasm, and with absence of any disease. So same way, what we speak about Ayurgenomics today, nowadays, you showed the video of Dr. Mitali, who has done a great work on Ayurveda and genomics. So in Ayurveda genomics, it's a new study, which is an innovative study blending the principles of Ayurveda together with genetics, which is modern. So it's a combination or a marriage of Western and a modern science. And I'm sure it's going to come up with a very beautiful things because Ayurveda has an ancient knowledge and now Western, we have all the modern technologies of finding out each and everything, whatever was written in those time. So as everybody knows, I'm not going to spend lots of time explaining you about chromosome and genes and all these things. But chromosomes carry genes arranged in a linear thread. It's a basic unit of heredity. Like whatever we inherited from our previous generation are coded in this DNS or genes or chromosomes. So now we'll see what was written in Ayurveda about all these things. So this is all about Western theory. Genetic disease etiology is lack excessive or abnormal genes, which is same exactly explained in Ayurveda, which I'll tell you in the next slides how it is same similarly explained in Ayurveda about lack of genes, excessive genes or abnormal genes. Also, in Western, it says simply inherited, autosomal and X-linked, and then multifactorial, multiple gene environmental factor. And the treatment of genetic disorders or genetics is hormone replacement therapy, which is not very successful. And the another one is gene therapy, which is ethically not good. So both is very difficult to practice. But we can practice whatever was written in ancient times in Ayurveda. So if you see in Ayurveda, if you compare whatever is given in modern nowadays, a genetic disorder is a disease caused by abnormalities in genes or chromosomes, which in Ayurveda is called Anuvanshik Vyadhi. Anuvanshik yani from our all previous generations, whatever is coming to us is called Anuvanshik Vyadhi, which is called as genetic disorder in modern. Then if we see beej or sperm or ovum or embryos, it is called as beej in Ayurveda. And whatever is called as chromosome, it's similar to beej bhag. And whatever is called as gene is a beej bhag avayav. I'll explain about each and everything in the next slides. Okay. So Ayurveda says when many beej bhag combines together, it forms a beej or a seed. Same way in Western, they say there is a lots of combination of genes and chromosomes to make one specimen or a one organ or a one person or a one individual. Same way Ayurveda says you require three things. First is beej, second is beej bhag, and third is beej bhag avayav. Now I'll just explain you with the shlokas. This shloka was written in Charak Samhita, chapter number 4 in Sharirasthan, about how infertile babies are born. Like nowadays, I've seen so many people who are having infertility problem. They are not able to conceive, or if they conceive, the babies die. They don't grow inside the uterus. Even we have seen so many IVF and IUI procedures done, but they don't succeed easily. I have seen so many couples that 5 IUI, 10 IUI, 10 IVF are failed. They are not able to conceive. But when they start the Ayurvedic treatment, they take proper herbs, proper diet, proper lifestyle, they conceive very easily. Even without doing IVF or IUI, they naturally conceive. Or sometimes if the case is really difficult, then if they try for IVF and IUI, they get success within first or second cycle. So why this happens in Ayurveda? Because Ayurveda had already mentioned all this problem 5,000 years back in these simple shlokas, which I'm not going to say the shlokas because you won't be able to understand, but I'll explain you the meaning of the shloka. The shloka says the first one, like dosha aggravating factors. If the mother and father or their previous generation, like grandmothers and grandfathers or grandparents, have done wrong diet and wrong lifestyle, they pass on their bad genes or defective genes to the future generation. Same way, for example, if that bad genes are transferred to the parents, the child of that parent, like for example, in Ayurveda, it is said if the beej or full sperm or full ovum or beej is completely vikrut or damaged, then if that damage is inside the uterine part, then that uterus of the baby or the female which is going to be born for that couple will have infertility issues. Or if the sperm is damaged, the part of that sperm which is responsible for the baby, if that beej is damaged, then the male which is going to be born by that couple is going to have a infertility or azoospermia or lack of sperms, or in Ayurveda, the names are given as Vandya or Vandya. Vandya in female and Vandya in male. So they will give birth to a infertile female or infertile male if there is a problem in ovum or sperm. Second one, Ayurveda says Bij Bhag means not full seed, but the part of that seed, if it is damaged, part of the uterus gene, if it is damaged in the female, then the female which is going to be born by that female will have Puti Praja. Puti Praja means that female will not able to hold the babies in her uterus, and then she will have lots of history of miscarriage or abortions. And if the Bij Bhag of the male is damaged or the gene of that male is damaged, then the fetus, the sperm will get damaged, and the baby boy which is going to be conceived will have problems of infertility. The third one, it says Bij Bhag Avayav. The second one, the name in Sanskrit is, it is called Puti Praja or Puti Praj. For that male, the name is given in Sanskrit. If the Bij Bhag Avayav or the gene is damaged or the part of that sperm or the part of their ovum which is responsible for fertility is damaged, then the male child which is produced by that couple will look like male but won't have characteristics of male. And if the female is born to that type of couple which has Bij Bhag Avayav damage, then the female which is born will look like female but won't have that kind of male or female. Sorry.
Carry on, carry on.
Okay. So that kind of male or female in Ayurveda is called Varta or Puti Praja. So you can imagine, 5,000 years back, they had knowledge of all these things, which we are seeing now. After 5,000 years, we are getting PCOD people, we are having infertility issues, we are having low AMH issues. I used to see like infertility couples when I started my practice around 20 years back. I used to see very few, like one or two couple in a month used to come for fertility issues. But now I see like every day 5 to 6 couples, they come for the fertility issues. Why? Because of our wrong diet and wrong lifestyle. Slowly the genes are damaged, the chromosomes are damaged, and we are going towards all the problems and all imbalances in our body. So now, as I told you, there was a discussion in Charak Samhita in between two rishis, Agnivesh and Atreya. So from this conversation, they asked different questions about genetics, how genetics was derived. And after asking certain questions, then they knew about all genetics. So first, Agnivesh asked Atreya, why abnormal couple doesn't produce abnormal children like them and vice versa. So you must have seen, the couples who are dumb or deaf or handicapped, their kids are not necessary that the kids will also become deaf or dumb or handicapped. They also produce so many healthy babies or healthy kids. Or vice versa, you must have seen the healthy couples who don't have any hearing problem or any blindness or any handicap problems, but they may produce blind or hearing problem babies, or they may have babies with Down syndromes or chromosomal syndromes. So when this question was asked in Charak Samhita, then he answered that because of the damage of Bij Bhag and Bij Bhag Avayav, they are able to produce normal or abnormal kids. So if the Bij and Bij Bhag of a normal couple is having damage or imbalance, they may produce abnormal children. If they are normal, still they will be able to produce abnormal kids. And if the Bij and Bij Bhag Avayav are normal, they will be able to produce a normal babies. In spite of they being having blindness or hearing loss, they will have a good and healthy babies. And the second thing Rishi said, it is also depending on the Deva. Deva means Dev or past karma. Past karma doesn't means the past karma which we believe in our spiritualism, but past means parents' past karma. If the parents have not done proper diet and lifestyle, it will affect the babies. So the parents should do proper diet and proper lifestyle and proper mind, controlling things before producing babies, so that they will not pass the bad genes to their childrens. And then the another thing the Rishi said is Atma Karma. Atma Karma means then it comes about that baby's own karmas, like past life karma and all. All these things will contribute to a healthy baby or unhealthy baby depending on the parents or their own karmas. Then there is one chapter in Ayurveda called Atulya Gotriya Adhyay. So it says to prevent genetic disorders in your next generation. If you want your next generation to be healthy, and if you want our nation or world to be healthy, you have to practice these things to give birth to a really healthy and strong minded and physically strong kids. For that, Ayurveda says you have to find a suitable match for the marriage. The husband wife should be a suitable match. So for the suitable match, Ayurveda says there should be no history of transmissible disease in any of the family. If any of the family is having any kind of transmissible disease, they may pass on their genes to the next generation. Then second, the anatomy of a boy and a girl should be normal, like too much tall or too much short or any different kind of anatomy will give birth to a next generation having bad genes. And the gotras should be different. Like we believe a lot in gotras. You must have seen there are certain religions, they get married in the same gotras. And I have seen in my practice so many babies they produce with Down syndrome and chromosomal disorders. And Ayurveda had explained it already 5,000 years back that same Gotra marriage will lead to many genetic disorders. So Ayurveda says Gotra should be different when you get married. And then Ayurveda again defines when the baby is formed, what are the things which helps to form a proper or healthy baby or a baby with having a disorders. So Ayurveda says Matrutah, Pitrutah, Atmatah, Satmatah, Rasatah, Satvatah. There are 6 things which contribute to produce a normal or abnormal baby. Mother, father, soul means Atma, wholesome regimen like diet and lifestyle. Rasa means nutrition food which goes to the baby, and a proper mind. So we will talk about everything in detail. So first, it is called as Garbhakar Bhav, means the things which produce a proper fetus. The first one is called Matruj. Matruj and Pitruj means maternal and paternal diet and lifestyle. If mothers and fathers' diet and lifestyle is good, then they will have a good and healthy baby. Nowadays, I see so many couples, they have problems with ovulation. Then the males are having sexual problems. They are not able to perform sex properly, and their count is very low. And when I go into history, mainly the males, they are into alcohol or smoking, or nowadays there is a big trend of hookah. They think that hookah doesn't damage semen or doesn't give any problem to the sex. But I've seen males having issues with sperms and motility issues when they have all these bad habits. And the females, nowadays it's very common. Females also, they go to pub and they enjoy alcohol everyday basis, or they are also into alcohol and smoking and all these things, but they don't know they're damaging their next generation. And because of their diet and lifestyle, their future children and future babies are going to suffer. So your diet and lifestyle would be proper. I'll explain you about all what should be diet and lifestyle in the next slides. Then third thing is sattva, which contributes to a good embryo or good baby. Sattva means 3 mental properties or mansik gunas, which is called sattva, raja, and tamma. So we all have 3 kinds of mental properties. That is a big vast subject. We can talk about it later on. But to increase more sattva guna in the baby, When we are pregnant, we should we should be listening to good mantras or good music or do daiva karma. Daiva karma means puja, visiting the temples, and be spiritual, try to help others and have positive attitudes. Like when I was pregnant with my son, I used to do every day 1 hour meditation. I used to do whatever spiritual activities I can. And after 5th or 6th months, the babies has hearing capacity, so they will be able to hear whatever you are listening. If you are listening good mantras and good literatures, like my mother used to tell me when I was in her womb, she used to read Ramayana, and she used to read Bhagavad Gita. So whatever you read, that all sanskars will go to your baby. So try to do more spiritual things when you are pregnant. It will definitely give a positive effect to your future babies, and your future generation will be really very good in sattva wise. Like mentally, they will be very strong, very positive, and they will be able to survive in all positive and negative situations throughout their life if you take care of yourself during pregnancy. Then the next thing is called Satmya and Rasa. Satmya and Rasa is also during pregnancy. Whatever food you will eat, that food will nourish your baby, as well as your baby will get used to with that food. So if you are eating a junk food when you are pregnant, like pizza and vada pav and bhajia and samosa and all these things, your baby, when the baby is born, he will be also, or she will be also inclined toward junk food, and the baby will also start getting all the disorders. So always try to eat more sattvic food when you are pregnant. Don't, or try to avoid eating outside in the restaurant and on laris and all these things, because it is definitely going to affect your baby's health and their genes, and the next generation genes will become bad and bad. For example, our great grandfathers, they used to work so much in the fields. They used to never have car or taxis or all these things which we have nowadays. And there you haven't heard about heart attacks or diabetes or cholesterol or heart block. Never. I have never heard about my grandparents having, heart disease or heart block. But nowadays, you must have heard at the age of 25, 35, the young generation, they are getting heart problems. Why? Because our genes are getting worse and worse day by day. So if you want your future generation to have better and better genes, you have to start following it from yourself, so that next generation will be good. You can produce better children and better future for our next generation. Then the last bhav is called Atma. Means you have to also work on your Atma and be more positive and spiritual. So these are the six bhava which contribute to a good next generation or good baby or good garbha. Now about matruj. So you will ask, from mother, what will come from mother? So there are in Ayurveda, before 5,000 years, they knew which organs mother is going to contribute and which organs are contributed by the father. So if any of these organ, genes or chromosome is damaged in mother, then that will be damaged in the next future baby. So these are the organs which will come to your baby from mother to the muscles, whichever is the organs which are soft or like very delicate, those are all transferred from the mother to the babies. Then there are certain organs which will transfer, which are formed by father or paternal tissues, which are like thick and hard organs like bones, mustaches, nails, teeth. All this will come from the male. So if male is having anything or any problem in these organs, that will be transferred to the next generation or the next baby. Now, genetic diseases in Ayurveda. So about this one, I'll just share a small example with you. I used to have one fertility couple. I just remembered that example, so I want to share with you. So that couple was not able to conceive and they used to come to me for conception. I gave them proper supplements. And when they conceived, the baby was having so many hairs in his head, but the father was not having that much hair. He was literally bald. But the baby had lots of hair. Why? Because they were taking the Ayurvedic supplements, and that contributed a good gene or good hair growth in that baby. So after they conceived a male child, I told him, why do you not stop my supplements now? You already have the result. You've already got the baby. Why do you want to continue them? So the father said, I want to continue the supplements because after I started your supplements, I see better results in my teeth, in my falling of my eyebrows or eyelashes, and my nails are becoming more stronger. And I had to go for more and more root canal before. And because I started your supplements for the bones and for fertility, my bones I feel are more stronger, and my joints pain have literally gone away. So I would like to continue the supplements which you gave for fertility for me. So I always tell people, Ayurveda doesn't have side effect if it is given properly. In fact, it will give you side benefits instead of giving you side effect. So next is genetic disease in Ayurveda. So Ayurveda already knew about genetic disorders, and Ayurveda already mentioned everything about the genetic disorder that time. Ayurveda says there are different kind of genetic diseases, different reasons of getting genetic disease in the future generation. First is Sahaja. Sahaja means from the parents it is transferred to the babies. For example, diabetes. If parents are diabetic, the babies may have diabetes. And if you take care of yourself properly before conception, you won't pass the diabetes to your babies. Second is Coolage. Coolage means family. If there is any disease in the family like epilepsy or leprosy or vitiligo, then from the family it can be transferred to the next generation. Then Ayurveda said Prakriti Prabhav. If whatever is parents' nature or Prakriti, they may transfer to the babies if they have not taken care of their own Prakriti. Then Ayurveda says Adi Bala Pravritta means Bija Vikruti. Like if their genes or chromosomes is damaged, then they may pass the bad genes. Like if they are having genetic disorder of the anal area, they may pass the piles disease. Or if they have skin problem, then they may pass eczema to the babies. Then Kala means environment, season or time. The time of conception, that also we see. If the time of conception is proper, if the age is proper, if the season is proper, then the babies will be very healthy. Then Mahabhuta. Mahabhuta means five elements: Prithvi, Jal, Tej, Vayu, and Akash. If the five elements are properly in balance, then the baby will have balanced doshas. So about doshas and all, you can see the previous recordings, or we will discuss little bit in the next slides. It's a very vast, deep subject. So simple, I'll tell you about Vat, Pitta and Kapha. Ayurveda believes in five elements theory: air, water, fire, space, and ether. So out of these five elements, balance and imbalance, we get healthy or we get sicknesses. So Ayurveda says always balance your air or five elements to have a better and healthy life. Vat, Pitta and Kapha. So for example, I'll show a little example. Can you start my video?
Yes, you can. Wait, hold on.
Yeah. So, for example, I'll share with you some example of Vata, Pitta and Kapha. There are three doshas. I think everyone must be knowing if you are attending Ayurveda lecture. You should know about Vata, Pitta and Kapha little bit. So I share with you a small example of Vata, Pitta and Kapha. If you have lots of air and space element in your stomach, what will happen? You may get bloating or gases, or the stools will be dry or constipated. The gas has a tendency to always move up. So, for example, if the gas moves up, what will happen? The gas will come in the heart area. You get chest palpitation, anxiety, difficulty in breathing. You know, the same air if it comes up. For example, if that person is eating lots of raw vegetable, raw salad, or heavy beans or chickpeas, what will happen to that air element? The air element will increase and it will come up because air has a tendency to always move. Air doesn't stay at one place, it always keeps moving. So if the air comes up in the neck area, then you get thyroid issues because it starts drying the thyroid. Same air, if it goes up in the head area, then you get all mental issues like anxiety, depression, difficulty in sleep, too many dreams in the sleep, and the dreams will be all airy like flying and all these kinds of, or quivering kind of dreams you will see. So that is nothing but too much air in your body. And if the same kind of person is eating lots of airy foods, then the air will increase more and more, and it will go throughout all his body, and the all the body will be filled up with lots of air and space, and the person will start having joints pain, body ache, arthritis, and all the issues related with the joints, or susti, thakawat, kamjori. All these things the person will have, and the dryness of the skin, dryness of the joints, the cracking sounds in the joints, like the cracking sound in the neck, and when they're walking, they will start having cracking sound in the knee joints and the back, and all these things. Stiffness is nothing but lots of air element in your system. So Ayurveda says this is a vata imbalance, or when you have too much air in your body. Then second is called pitta, or the fire element. When when a person eats lots of tomato, yogurt, tamarind, citric and fermented food, then they create lots of acid or heat in the system. And the same acid will start to damage the skin, hair, eyes, and they start to have lots of acidity, skin issues like eczema, pimples, psoriasis, freckles, and dark skin, dark circles. So many, all the skin disorders, acne, rosacea, falling of hair, alopecia, dandruff, all this is nothing but pitta imbalance or fire. So if a person is fire kind, they should avoid all the citric and fermented food and try to eat more cooling and healing kind of food, which I'll explain you in next slides. And the third one is called kapha imbalance. So when you have lots of air and water element in your system, what will happen? Your body will bloat too much. You will start getting diabetes, cholesterol, heart block, and then you will have urinary tract infection. Everything related to respiratory issues like breathlessness, cough, cold, asthma is nothing but too much kapha in your body. So this is a small example of Vat, Pitta and Kapha, how it is. If you want to find out properly, you have to come for the personally pulse reading. So by reading the pulse, we'll be able to find out your imbalance, and we will be able to tell you what kind of diet exactly you need and what kind of lifestyle. Like exactly what you do in genomics, you find out which kind of DNA, and then you give the diet and lifestyle. Same way we see the pulse and we find out your Prakriti and Vikruti, and then we advise you different kind of diet and lifestyle. So same way, there are so many shlokas and mantras in Ayurveda. I try to take little bit, but there are so many references you can see in Ayurveda 5,000 years before, that they already wrote about genetics in detail, in deep. Everything was written. Like for example, about the sense organs, or past life, or chromosomal disorders, or Down syndromes. Everything was written. The reasons was written, like past life karma. Nowadays they say idiopathic. Like for any disease, they don't have the reason. So when they don't get the reason, they said idiopathic. But Ayurveda doesn't say idiopathic. Ayurveda says past life karma. If your parents have not done proper diet and lifestyle, if your grandparents' diet and lifestyle was wrong, then the same genes came to you and produced this problem. So, which is called a past life karma. And the offsprings of a dull parents do not necessarily resemble their parents in those qualities. That was also given in Ayurveda. If the parents are dull, the children are not 100% going to be dull. They may be active. Like we have seen so many parents, they have mental issues. They are dull, they are tired, they are depressed. But the babies are strong. Their generation is strong. They don't have all this problem. And vice versa. The parents were very strong, but the babies are depressed and dull. So the reason of that was also given in Ayurveda that time. That why it was done. Because of the past karma of the past generation. So we are responsible for our future generation. So we have to open our eyes and start following everything properly. So now prevention of genetic disorders, Ayurveda says there are many, many things in Ayurveda it's written. I have taken the simple things which are important. So first I already explained about marriage, who should get married. Second, Ayurveda always emphasizes on panchakarma before getting pregnant. Or if you have any genetic disorder or if you are suffering from any hereditary disorders from your parents, or if you don't want to pass on your diseases to your future generation, panchakarma is the best technique. So in panchakarma we completely detoxify your system. Like for example, we go to service our car regularly. Once in every 3 months or 6 months we service our car, but we never thought of our body. It's like 50 years old, 60 years old, we never thought of servicing our body. But Ayurveda says you should service your body regularly. Your joints should be well lubricated, your skin should be soft and supple, you should have a good metabolism and digestion. So for that, the best thing is panchakarma. Then third thing, Ayurveda says Punsavan Vidhi. Punsavan Vidhi is done with different kind of herbs and different diet and lifestyle for better genes and better chromosomes in the baby. Then Vajikaran. Vajikaran means there are certain diet and lifestyle which enhances the sexual activities of a female and a male. So they will be able to perform better sexual activities, and they will be able to have more sperms and more good quality of ovums with the supplements and the diet which is called Vajikaran diet and supplements in Ayurveda, like Ashwagandha, Shatavari, Shilaji. There are so many herbs given in Ayurveda, and so many diet like Urad ki dal or kheer. I'll explain you in next slides all the diet. Then next is Garbhadhan. Garbhadhan means when you are conceiving or when you are trying to conceive a proper healthy baby, Ayurveda says you should be inviting that good soul in your body. Just like it's not just for fun, like one night stand. Nowadays new generation, it should be not like that. When you are trying for conception, it is like a proper procedure and a vidhi which is given in Ayurveda, that you should invite a better soul in your body. So Avahan means to invite a proper soul, which is very good quality, which is having very good health, good mental and physical things in the fetus. So Avahan or imitation is called Garbhadan Avahanam. And in that there is a very beautiful mantra which says Ahirasi Sutam. So when you are trying to conceive, you should chant this mantra. Ahirasi Sutam means, oh God, please give me the best soul for my future generation. I want the best baby in my womb or in my generation, which will be able to serve the next generation and the world properly. So that is called Avahan, or give a good positive things to that baby in future which is going to be born. Then Garbhasthapaniya Dravya Sevan. Like in Ayurveda, we have Masanumasik Prayog. Like every month, a female should eat certain kind of diet and certain herbs. So month-wise, we have different diet and lifestyle which should be followed by a female. Then Garbhopahara Bhava Varjan means when the female is pregnant, what the female should avoid. Like nowadays, when the female is pregnant, they watch all the horrible movies with the fighting and scary movies and depressive movies, or many bad things which they show nowadays, which we are seeing and which is impacting the next generation. So try to avoid those things. Try to avoid lifting too much weight, too much heavy exercises, or sitting at one position at for longer time. Try to be more active, more positive, and more good diet and lifestyle you should follow during pregnancy. Then dohrad. Dohrad means everybody must have known about the इच्छा होती है कुछ खाने की, after the fourth month, or Ayurveda says the female is having dohrad. Dohrad means two. Two hriday means two hearts are beating inside her. So when she has two hearts beating inside her, she will crave for different things. And the craving will be depending on what is lacking in that baby, what genes is lacking. So try to fulfill those cravings by giving the proper food to that female, which can properly nourish the genes and the chromosome of that baby. So the diet before conception should be warm, nourishing moong, rice, khichdi, vegetables, ghee, almond, date. All these things is very good for nourishing, and it will help to produce a proper ovum and a proper sperm, and a healthy ovum and a healthy sperm. Next thing Ayurveda believes is Vata. Vata, or the air element, is always responsible for aging or anything which is damaging in your system, or too much dryness. So try to avoid too much drying food like chickpeas, wal, chana, vatana, chole, raw vegetables, raw salad, too much sprouted beans. People say you should eat sprouted, sprouted, sprouted. But in Ayurveda, there is nothing about sprouted anywhere written. If you want to eat sprouted, try to steam it or cook it. And then use proper spices like warming spices, kanda, onion, garlic, then the air element will go down. If you are eating lots of raw sprouts, then it will give you more rawness or more dryness or joints pain or skin disease. It is not only for the conception, it's even for the general people. If you want to look or feel younger and stronger or live more healthier, then try to avoid vata increasing foods in your diet. And deep fried food, obviously. So before conception, or even generally, try to have 1 teaspoonful of sesame seeds every day. Sesame seed is a rich source of calcium and magnesium. So it will give you more good bones and more hair and strength and stamina and good calcium and teeth, nails, everything will be strong. So try to eat more sesame seeds. Then eat urad dal every alternate day. If you have a less AMH, or if the eggs or the sperm is low in count, try to eat more urad dal at least alternate days. That will increase the ovum and the sperm count, quality and quantity wise. And even for the health, it is good if you are a vata type. So if you are having lots of air and bloating, people say urad will increase gas, but urad is heavy in nature, so it will balance the gas if you use proper spices when you are cooking. If you are cooking it with proper warming spices, it won't give you lots of heaviness or gases or bloating. Then sesame oil massage, alternate days, is very good to reduce vata. So Ayurveda says always try to reduce vata when you are trying to become pregnant. Or in general also, if you want to look young or healthy, or if you want to have a beautiful skin, hair and eyes, try to balance your vata and try to, eat more warm, liquid and soupy foods. Then for pregnancy, the best is cow's ghee or falagruta every day in the morning on empty stomach, 1 teaspoonful. Then I'll share some example with you with some testimonies, which by following the diet and lifestyle, which I'm going to share in next slides, what are the effects? I want to share with you first the results, and then you will be able to know the importance of this diet and lifestyle, which I'm going to explain you. So you will be able to listen and follow it carefully. If you see the results which I have shown. So this lady, she is like she's coming to me since more than 20 years. and she's become like my best friend now. At the age of 65, with history of obesity, arthritis, hair fall, high blood pressure, high blood sugar, everything is now under control, and she lost 15 kilo. And you can see how she looks now. She looks like a college girl at the age of 65, and she has so many hairs now. Look at her hair. Look at the first picture, how was her hair, and now you see her hair. She comes to me regularly whenever I visit India every 2 to 3 months. I'm in India for 2 months, and then I come back to America. I'm here for 3 months. So I keep visiting India and America frequently. So whenever I go to India, she comes to me for consultation for pulse reading, and every time she tells me, "Please, Dr. Sumita, take my photo of my hair and show to all your patients, so that they will be encouraged to follow Ayurveda." So this is the result. See, look at her hair at the age of 65. She has more beautiful hair than me. I get envy from her hair. Then this female, she had arthritis issues and many other problems, completely gone, and she lost something like 20 to 25 kg by following my diet and lifestyle. Then this is a case of psoriasis. He was suffering from severe psoriasis all over his body. He was not able to get married also. And no, even when he came to me first time, he wrapped his hand in a towel because he was very shy to come in a bus. If someone sees his hand, they won't sit near him because it was looking so horrible. And when I asked him, "Why are you wrapping the towel around it?" So he said, "I always come like this because I don't like people to get scared by looking at my hand because I have so bad skin disease." And he took proper diet, lifestyle, and herbs. He got married. He has 2 kids now, and see how he looks. Completely gone. His kidney was getting damaged because of taking lots of steroids and anti-allergic medicines. Completely normal. All of his skin came back again, and he's completely healthy now. You can see. Then this is a very good testimonial of a doctor parents. They conceived after the 5 years of marriage a very healthy baby with only 3 months of supplements. Just 3 months of my supplement and diet, and she conceived naturally. And they were trying since 5 years. So, according to Ayurveda, there are certain herbs which enhances your health, keeps you more young and healthy and glowing for longer time. So these are the names of the supplements which will give you full energy. The first one is like multivitamin supplements. So it will give you natural iron, calcium, hemoglobin, everything naturally without any chemicals. Then there are supplements for immunity, for mind, for sexual performance, then for better sperm count, then regular cycles, for PCOD, for many different issues. We have very good supplements. Then about diet or lifestyle, Ayurveda says there are certain diet and lifestyle you should follow in order to remain healthy. This is not only for the conception, but for everyone who wants to live healthy and 100 years without any disease or with a good quality of life. So when hungry during pitta time before 12 o'clock, you should eat, Ayurveda says. Then when your motions are clear in the morning, then only you should have a breakfast. Then after feeling light and getting clean burp, then only you should eat. And signs, heaviness. If your stomach is feeling bloated or heavy, try to avoid food and try to drink more water so that the old food which you have eaten will get digested, and then your metabolism is corrected. Am I audible?
Yes, yes, very much.
Okay. So Ayurveda says how many times to eat. So for that also Ayurveda says it will depend on your Prakruti or Vikruti. If you are airy kind of person or having arthritis or gas or bloating, then your metabolism will be up and down. Sometimes you will have a great metabolism. Sometimes your digestion will be very low. Sometimes you will feel hungry. Sometimes you won't feel hungry. So Ayurveda very simply says, you must have seen nowadays people following so many different kinds of diet. You won't believe, 14 hours fasting, then eat within only 8 hours, you eat whatever you can eat maximum, and then eat smaller and frequent meals. So many theories you must have seen for diet. But Ayurveda has a simple answer. Ayurveda says eat when you are hungry and drink when you are thirsty, sleep when you are sleepy. Ayurveda says vegan na dharayet, means the natural urges you should not stop. If you stop the natural urges, you will suffer in future. So don't listen to all those theories, thousands of theories about, vegan, raw diet and whatnot. Just follow the simple rule, eat when hungry, drink when thirsty, sleep when sleeping. So eat according to your prakriti. Whenever you are hungry, eat. If you feel too much hunger, then have little bigger meals. If your hunger is less, then eat less meal. Try to fill your stomach half. Don't overload your stomach. That is the rule of Ayurveda. Then digestive fire. See how your digestion is. Like Pitta people will have very strong Agni. You must have seen if you go in marriage, there are so many people, they refill their plate 3 times, 4 times, They go on taking, अरे कॉन्टिनेंटल खा लिया, चलो अभी दाल चावल भी खाना जरूरी है, तो दाल चावल खा लेते हैं. अरे पानी पूरी का भी स्टॉल है, चलो पानी पूरी, सेव पूरी, भेल पूरी सब टेस्ट कर लेते हैं, They eat all those things, but still they are skinny. But what happens to us? एक पानी पूरी के स्टॉल पे 2 पानी पूरी भी खा लिया तो पेट फुल हो जाता है. हम आगे का तो टेस्ट ही नहीं कर पाते, कुछ वसूल नहीं कर पाते, या वी आर नॉट एबल टू एंजॉय द अनलिमिटेड थालीज. पीपल, पूरा पैसा वसूल करते हैं, अनलिमिटेड महाराजा भोग, महारानी थाली, क्या क्या सब खा लेते हैं. सो उसमें ये प्रॉब्लम नहीं है कि वो इतना खा लेता है फिर भी पतला है और मैं थोड़ा भी खाती हूँ तो इतनी मोटी क्यों है. सो द मेन रीजन लाइज इन योर डाइजेस्टिव फायर. उनकी जो है तीक्ष्ण अग्नि है. तीक्ष्ण मीन्स स्ट्रॉन्ग डाइजेस्टिव फायर. व्हेन अ पर्सन इज हैविंग तीक्ष्ण अग्नि, दे आर पित्ता काइंड और फायर पीपल. वो लोग को जो भी दो वो भस्म कर जाएंगे. पत्थर भी खाएंगे तो पच जाएगा उनको. तो और हम हवा भी खाएंगे तो फूल जाएंगे. तो it depends on your digestive fire. So Ayurveda says always correct and balance your digestive fire in able to digest your food properly and have a good health. And then लाइफस्टाइल में भी आयुर्वेद बताता है कि ब्रह्म मुहूर्ते उत्तिष्ठे जीर्णा जीर्णम निरूपयन, यानी सूर्योदय होने के 1 घंटे पहले मिनिमम आपको उठना है. पर कब उठना है? जब आपको लगे कि आपका खाना पच गया है और आपका डाइजेशन बराबर हो गया और आपको मोशन आने वाला है, देन यू कैन वेक अप. तो ब्रह्म मुहूर्ते उत्तिष्ठे जीर्णा जीर्णम निरूपयन. तो वो हिसाब से आपको बहुत सारे डाइट और लाइफस्टाइल है, उसके बारे में हम आगे बात कर सकते हैं, वो घंटों तक लेक्चर चलेगा. तो ये सिंपल आपको छोटी छोटी बातें मैं बता रही हूँ. फिर हम बोलते हैं हाउ मच टू ईट. जैसे मैंने बताया कि जब खाना खाने बैठते हैं, अपना कुछ फेवरेट खाना आ गया तो हम सोचते नहीं कि कहाँ तक खाना पहुंचा है, यहाँ तक हम खा लेते हैं. तो वो आधा स्टमक भर के वो सब नियम हम भूल जाते हैं. तो आयुर्वेदा से कितनी क्वांटिटी में खाना चाहिए, किसको कितना खाना चाहिए, उसमें भी आयुर्वेद ने बताया कि आपकी प्रकृति देख के आप खाओ. आप वात प्रकृति है, पित्त प्रकृति है, कफ प्रकृति है. अगर आप पित्त प्रकृति है तो आप प्रॉपर खाना खा सकते हो. कफ प्रकृति है तो लिमिट में खाना खाओ. वात प्रकृति है तो आपकी पाचन शक्ति के अनुसार खाओ. देन उम्र के हिसाब से, जवानी में तो हम कंपटीशन लगाते थे कि तू कितना ज्यादा समोसा खाएगा, मैं कितना ज्यादा समोसा खाऊंगा. बट वही आज की तारीख में अगर हम समोसा एक भी खा लेते हैं तो पेट फूल जाता है या खट्टी डकारे आने लगते हैं. तो वो कंपटीशन अभी हम नहीं कर पाते क्योंकि हमारी एज अलग है. तो आयुर्वेद बताता है कि अकॉर्डिंग टू योर एज यू शुड ईट द फूड. So when you are young, you have lots of fire or pitta, and you will be able to digest food very quickly. और आप ज्यादा खा सकते हो. बट अगर आपकी एक एज हो गई है तो आपको लिमिट में खाना खाना है. फिर लाइफस्टाइल मैंने बता दिया. खाना जब खाए तो 2 भाग आपका खाना होना चाहिए, 1 भाग पानी होना चाहिए और 1 भाग आपका स्टमक खाली रहना चाहिए आपका फूड को घूमने के लिए, फॉर सर्कुलेशन. ताकि द फूड शुड बी प्रॉपरली मेटाबोलाइज और अच्छे से वो अंदर घूम के अच्छा प्रॉपर बोलस बन सके. सो फॉर दैट वन फोर्थ पार्ट ऑफ योर स्टमक शुड बी एम्प्टी. So same thing I have explained in the next slide. Then Ayurveda says rasa. I told you about the rasa bhava. When the baby is conceiving, जो 6 भाव मैंने बताया उसमें से एक रसज भाव है. तो रस means 6 taste. There are 6 different taste your food should have. आपके खाने में हमेशा 6 प्रकार के स्वाद होने चाहिए. Then you will be healthy. So Ayurveda says there are 6 kind of taste: sweet, sour, salty, pungent, bitter, and astringent. मधुर, अम्ल, लवण, कटु, तिक्त और कषाय. So in Indian food we have seen, जो हमारी मम्मी हमारे नाना नानी they used to make food. They used to put so many things in the when they were cooking the vegetables like rai, jeera, hing, mirchi, lasan, adrak. Why? Because they all have different taste. सबके अंदर अलग अलग स्वाद रस होता है. सबका अलग अलग टेस्ट होता है. तो वो हर एक रस हमारे खाने में होना चाहिए जब हम खाना खाते हैं तब. तो आयुर्वेदा सेज फॉर ऑल दिस 6 days व्हाट इज द बेस्ट टू ईट. तो स्वीट यानी मधुर रस का सबसे बेस्ट चीज क्या होता है. तो स्वीट फ्रूट्स आप खाने में यूज कर सकते हो. बीट, स्वीट पोटेटो, वार्म मिल्क. मिल्क भी नेचुरली स्वीट होता है. सोप नट्स जैसे रेजिन्स है, खजूर है, ये सब आप सोप करके पानी फेंक के आप मीठे टेस्ट के लिए यूज करो. व्हेन यू आर कुकिंग यू शुड ईट राइस, बट द ओल्ड राइस. आप देख रहे हो इतना डायबिटीज बढ़ रहा है, इतना डायबिटीज बढ़ रहा है. इंडिया कैपिटल हो गया डायबिटीज का. Why? Because we are not following the rules which our ancestors were following while cooking. हम इंस्टेंट बनाना चाहते हैं कि चावल लिया, कुकर में डाला, सीटी बजाया, हो गया. बट उसकी वजह से क्या हो रहा है. डायबिटीज बढ़ रहा है, आर्थराइटिस बढ़ रहा है. आप देखेंगे आपकी नानी और दादियों को याद करो वो चावल कैसे बनाते थे. इफ यू हैव सीन देम मेकिंग राइस you will remember the proper style of making rice. If you make rice in that style, I promise you sugar नहीं बढ़ेगा, वजन नहीं बढ़ेगा. तो आयुर्वेदा says when you want to eat धान्य or any धान्य, you should eat them old. पुराना चावल खाओ, पुराना गेहूं खाओ. जितने ग्रेन्स पुराने होंगे, जैसे इन आयुर्वेदा विशेष द घी, हनी और घनवटी और एक्सट्रैक्ट. लाइक पीपल हु टेक माई सप्लीमेंट्स, आई टेल देम अगर आपके पास पुरानी दवाई पड़ी है, डोंट थ्रो माई सप्लीमेंट्स, कीप देम. इफ दे एक्सपायर ऑल्सो यू कैन टेक, बिकॉज द एक्सट्रैक्ट्स आर मोर इफेक्टिव व्हेन दे आर ओल्ड. तो दूध, सॉरी, हनी है, घी है, च्यवनप्राश है और धान्य है, ये जितने पुराने खाओगे दे आर वेरी इजी टू डाइजेस्ट. सो ट्राई टू स्टोर देम एवरी ईयर. तो एक एक साल पुराने चावल आप खाओ. देन व्हेन यू वांट टू ईट, लाइटली रोस्ट देम. आपने देखा होगा आपकी दादियों नानियों को उसको रोस्ट करके फिर चक्की में पीस देते हो. सो रोस्ट द ग्रेन्स बिफोर मेकिंग द पाउडर. रोस्ट लिटिल बिट और फिर देन मेक द फ्लोर ऑफ इट. और उसके बाद में उसका रोटी वगैरह बनाओ. और चावल जब बनाना है तो थोड़ा का सेक के सारे चावल डब्बे में भर के रखो. एंड देन व्हेन यू वांट टू मेक राइस, सोक इट फॉर सम टाइम एंड देन उसको छौंका दे के बनाना है. तो घी, देन जीरा, लवंग, ये सब डालो. पुट सम कार्डमम, देन यू पुट द राइस. और उसके बाद में राइस को प्रॉपरली घी के साथ के उबलता हुआ पानी उसमें डालो. And then you cook this rice and then you will be able to eat this rice without increasing your sugar or your weight. So try to have little rice in your food, have grains which are sweet in nature. तो ज्वारी का जो टेस्ट है is naturally sweet. नाचनी is naturally sweet. बाजरा आप खाओगे, it's naturally sweet. So try to have more millets in your food for sweet taste. I'm not telling you to eat sugar for sweet taste, but you can eat this naturally sweet food. Then for sour foods, Ayurveda says kokum, amla, and pomegranate is good. Salty, I have seen. आप ही मुझे बताओ थायराइड कितने सालों से बढ़ने लगा और कब से बढ़ने लगा? हैव यू एवर हर्ड अबाउट आयोडाइज सॉल्ट व्हेन योर ग्रैंडपेरेंट्स वर देयर? आपने कभी सुना कि उनको थायराइड था? कभी नहीं। दादा नाना नानी किसी को भी थायराइड नहीं था। वो लोग ने तो कभी आयोडाइज सॉल्ट नहीं खाया। तो ये थायराइड कब से आने लगे? जब से हम ये सब एनरिच फूड खाने लगे थे। आयोडीन ऊपर से डाला, ये ऊपर से डाला, वो ऊपर से डाला। कोई जरूरत नहीं है। आयुर्वेदा से द बेस्ट सॉल्ट इज सेंधव नमक। इफ यू ईट सेंधव नमक, आई हैव hundreds of people who were suffering from thyroid. They were taking so many thyroid pills. Their thyroid was not coming under control. ज्यादा थायराइड के लिए भी वही दवाई, कम थायराइड के लिए भी वही दवाई, खाली डोज बदलते रहता है। They just took the supplements, they properly followed the diet, they changed the salt to sendav namak, and slowly the thyroid came under control, and they were able to slowly reduce and get rid of the thyroid medication. So just use सेंधा नमक. सेंधा नमक is best for cooking and taste भी बहुत अच्छा आता है, and then you won't have any swelling or any iodine deficiency or any other issues. Then pungent food में यानी तीखे में पेपर, ब्लैक पेपर है, गार्लिक, अनियन, जिंजर, ऑल दिस थिंग्स। देन बीटर में करेला, ये सब को तो आपको पता ही है। ये सब एस्ट्रिंजेंट में ग्रीन लीफी वेजिटेबल्स, ब्लूबेरीज। सो ट्राई टू फॉलो ऑल दिस फूड। देन पानी, मैंने बताया बहुत सारे सवाल होते हैं, पानी कब पीना चाहिए, इतने सारे सवाल मुझे आते हैं। इतना लीटर पानी पियो। अरे मेरे पास आई हैव सो मेनी पीपल, दे ड्रिंक 2 लीटर वाटर इन द मॉर्निंग एंड दे स्टार्टेड हैविंग यूरिन प्रॉब्लम। थोड़ा खांसी खाया तो यूरिन निकल जाता है। दे आर नॉट एबल टू कंट्रोल यूरिन। अरे भाई किडनी है वो, कुछ और कुछ नहीं है जो आपका इतना 2 लीटर पानी को एक झटके में फ्लश आउट कर देगी। सो पूरा अपने किडनी के ऊपर रहम खाओ। 2-2 लीटर पानी कहीं पे भी आयुर्वेद में नहीं लिखा है। सो ड्रिंक व्हेन यू आर थर्स्टी। सुबह सुबह उठ के 2 लीटर पानी कहीं पे भी आयुर्वेद में नहीं लिखा है। ओके, सो ये सब नियम है पानी पीने के। देन eat the food which is better to digest, यानी lightly cooked food, मूंग, राइस, खिचड़ी, वेजिटेबल्स, मीठे फ्रूट्स, ये सब try to eat more in your diet. Then how much to eat again? तो जितना भूख है उतना खाना खाओ, जैसे मैंने बताया। cooked is better than raw, warm liquid soup is better than solid food. chew your food properly. मेरे पास सिएटल में एक पेशेंट आई, अमेरिका में मैंने लेक्चर किया था। वो टाइम पे उसने सिर्फ मेरा वर्कशॉप अटेंड किया। she took my supplements and she came back to me after the 4 months when I went back again. She lost 10 pounds, and I told her, what did you do? So she said, I just listened to your workshop, I took your supplement, and I started to chew my food properly. I started to chew 30 to 35 times, and I automatically lost my weight. So just by chewing the food properly, you will be able to lose your weight or improve your metabolism. So start chewing your food properly. अपनी जीभ को थोड़ा काम करने दो, अपने दांत को बोलो भाई अभी मुझे थोड़ा काम ज्यादा आज से करना शुरू करो और खाना अच्छे से पचाओ। देन सेम थिंग, कंस्टिट्यूशन यानी प्रकृति, इजी टू डाइजेस्ट, ओज बढ़ाने वाला खाना खाओ, यानी आपकी इम्यूनिटी बढ़ाने वाला खाना खाओ आयुर्वेद के अनुसार। ब्रेकफास्ट लाइक किंग, प्रिंस वगैरह तो सबको पता है। तो ब्रेकफास्ट लाइक किंग मैं हमेशा सबको बोलती हूँ, द बेस्ट थिंग इज टू हैव ड्राई फ्रूट्स एंड नट्स बिकॉज दे आर रिच सोर्स ऑफ vitamins and minerals and calcium. But don't have them raw. Again, Ayurveda is against raw. So soak them either overnight, throw the water, or put them in the water minimum 3 hours, throw the water, and take them properly in the morning. So this will have natural calcium, iron, vitamin supplements, everything which your body needs. So mentally or physically, you will feel more stronger and healthier. Then if you want to live healthy and with more strong brain and mind without any destructive emotions, try to have more sattvic food and avoid rajasic food which are written. These are all rajasic food which will make your mind agitated and angry and frustrated. So if you want to avoid anger, frustration and negative emotions, try to avoid these foods because this will increase more fire or pitta and Rajasic nature in your mind. Then how to improve your ojas. Ayurveda says ojas is the main thing for your immune system or for your health. If you have a ojas, so Ayurveda says ojo vruddho hi dehasya tushti pushti balodayah. Means if you have more ojas in your body, you will have more strength, more stamina, more energy, and more youth. So try to have more food which increases or enhances your ojas or immunity. So these are the foods which are mentioned in Ayurveda which will increase your ojas. And if you want to bring back your youth, if you want to reverse your aging process, try to avoid wheat. See, in Ayurveda, wheat is written everywhere. You should consume it. Wheat. Ayurveda is not against wheat. But the wheat which we are getting nowadays is with gluten. It is not the same wheat which we used to have earlier. And before we used to, our forefathers used to do so much field work. They were so much physically active. They were able to digest the wheat properly. But nowadays we are not able to digest the wheat properly. So try to have less quantity of wheat as much as possible and have organic wheat. And as I told you, have old wheat, try to roast it, keep it, and then make a flour of it and try to have in less quantity. Then yogurt also, Ayurveda says is abhishandi. Abhishandi means it blocks the channels. So if you want to have yogurt, try to have 1 part yogurt and 3 part water and mix with proper spices. Make proper buttermilk and use it. And in the daytime, not in the night time, because Ayurveda says dadim nishi na munje means yogurt should not be consumed at night. Then deep fried food and fermented food try to avoid or reduce. Then we believe in pulse reading, like all the 5 elements which I explained you are in your hand. So first one is Vata, Pitta and Kapha. If we have time, later on we will have a proper workshop on pulse reading where I'll teach you how to read your own pulse. But for now, if you have any imbalance, you can come to me in January. I'm coming back to India on 20th January. You can come and meet me for proper pulse reading and finding out what is the imbalance and what you may suffer in future or what you have now in your system. So as I told you, I've done MD in diabetes. My special thesis was on diabetes. So I had done a research on a herb, or I have written a thesis on a herb called Gudmar or Gymnema sylvestre, which is now very, very famous. Gudmar, as the name suggests, good means sweetness and mar means to kill. So it kills the sweetness in your body. Just by putting it in your mouth, you will see the result. So for example, if you put a leaf or a powder of Gudmar on your tongue, and afterwards, if you eat sugar, you will feel like you are eating mud. There is no taste of the sugar. So the herb starts working from your tongue, which I have done. I have made the formula called Mehalite from this herb, and it is very effective. You see the results, like in all the symptoms, like polyuria, if you are going for frequent urination again and again, within 3 months, the patients, they got 100% results. Then night urination, 98% result. Every symptoms were getting lesser and lesser just by taking the herb. Then even in the fasting sugar, which was above 250, it came down to 150 within 3 months. And there are certain more examples of acne with the pitta imbalance. Before and after, you can see the completely normal and healthy and glowing skin. This is a patient from Africa, East Africa. Then the case of vitiligo, he had all the white patches all over his face and neck and is gone. Then alopecia, the hair was gone. Now she has a more beautiful and shining and new hairs on the scalp. Then the case of seborrheic dermatitis or psoriasis, here complete, dryness and redness and itching of the skin and completely new skin he got. Then I showed you the example of my friend, patient. Then fertility issues. These are the twins born. Then many hundreds of cases I have on fertility. You can see on my website. I put all the pictures. So we have a very rich knowledge in Ayurveda, but we lack in the studies and the instruments. So I think if the Western and Ayurveda combines together, it will be a really good marriage. तो आगे जाके अच्छे embryos पैदा होंगे. So currently available diagnostic methods which are given in Western, we should combine in whatever is given in Ayurveda 5,000 years, and we will have really beautiful results that Ayurveda can definitely promise. So Ayurveda always says when there is a will, there is a way. So we will and we can. And Ayurveda always says there is solution for each and every problem in your system. You just need a proper diet, proper lifestyle, and proper herbs to balance all your doshas. And there is nothing in Ayurveda which doesn't has a solution. And it says sick people do not always die and healthy people do not always live. So sick, be hopeful, and healthy, be humble. Thank you so much.
थैंक यू सो मच डॉक्टर सुमिता प्रजापति. जैसे मैंने स्टार्टिंग में कहा था कि यू ऑल विल बी लकी, यू आर ऑल लकी बिकॉज यू आर नॉट ओनली गेटिंग अ लाइव session on Ayurveda all the way from Boston, USA, but at the end you're also getting a diet plan. I'm sure कि अगर आप expert के पास जाएंगे, you definitely need to shell out some money, and you need to take appointments, spend a lot of time. But ये सब दुनिया के कोई भी कोने से बैठ के जूम के जरिए, टेक्नोलॉजी के जरिए हो रहा है. And I think what Dr. Sumita Prajapati said, that all the diets which are personalized based on your age, medical conditions, your weight, and so many other things are explained in epigenetics, जो हम लोग genetics में कहते हैं. But even epigenetics was mentioned in Ayurveda 5,000 years back. So that's the beauty of our ancient wisdom. So ancient wisdom इसके लिए कहते हैं क्योंकि उसमें पूरे राज छुपे हुए हैं. बट देन वी हैव फॉरगॉटन, हम लोगों ने मॉडर्निटी को अडॉप्ट किया है, एंड इट्स नाउ बिकम अ स्टाइल स्टेटमेंट कि ये नहीं किया. बड़े बड़े हॉस्पिटल में एलईडी टीवी सोफा के सामने ट्रीटमेंट, मतलब ये होते हुए ट्रीटमेंट नहीं किया, देन बोलने में थोड़ा सा अच्छा नहीं लगता है. So that's what it is. So I'll open up for some questions, and Dr. Sumita, you can answer these questions if they want to ask. So chat box open hai, so you can not only acknowledge Dr. Sumita Prajapati, but then quickly ask. I know it's 9:20, but we can, whoever wants to leave, they can. But agar free में ज्ञान लेना हो, तो you can stay back definitely. So, all right. So, Manoj Kumar, very important session for us. And thank you. Informative.
Yes.
Okay, so आपने slide में देखा रहेगा. You can go to the website ayushanti.com and get details of Dr. Sumita Prajapati. उनका profession, उनके customer, मतलब patients, treatments, results, and ये सभी कर सकते हैं. Okay. Uh, yeah, KK Pandey from Delhi. Okay, KK Pandey, nice to have you. Then let him know the genetic perspective. Okay, which parents genes are stronger? ये एक सवाल पूछ रहे हैं. And second one is which foods from Ayurveda point of view are affected by genetics? दो सवाल हैं. Which parents gene, मतलब फादर और मदर में किसके जीन स्ट्रांग है? ये सवाल
दोनों
पूछा
के
है मिस्टर के बड़ा. दोनों के?
दोनों की जीन्स कम, दोनों के जीन्स इक्वल है.
Okay, and the second one
Both
is
contribute equally, maternal and paternal.
there is sometimes you have heard कि I think mother contributes more DNA to the baby. Is it true in Ayurveda में? इसके बारे में क्या?
आयुर्वेदा में तो 6 भाव ऑलरेडी मैंने बताया ना आपको, 6 के 6 भाव इक्वली कंट्रीब्यूट करते हैं.
Okay.
मातृज, पितृज, रसद, सात्मज, सत्वज, all 6 attribute equally.
All right. So, Dr. Girish Chaudhary, you can get to the website and then connect with Dr. Sumita Prajapati. And then, she is from Mumbai. And I must tell you that I was also one of her clients. Me and my wife, after we got married way back in 2003, and we had our first daughter in 2007. इसके पहले we had taken treatment from Dr. Sumita Prajapati. And when my first daughter was born, she was as fit as 4 kilos. So काफी heavy and काफी healthy daughter. And
healthy.
now she's 16, and when she comes down in the month of January, we'll definitely go and see her. And by the
Yes.
way, जो डॉक्टर, मैं हम लोग थोड़ा माई लाइटर मोमेंट्स में मैं डॉक्टर को बताता हूँ ये कि शी नॉट ओनली हैज गिवन दिस एडवाइस एंड प्रोफेशनल consultancy to a lot of married couples who are not able to conceive, but उनका डेमोन्स्ट्रेशन भी डॉक्टर सुमिता प्रजापति ने किया है. शी हैज अ वेरी हेल्दी ब्यूटीफुल सन. एंड जब भी लास्ट टाइम हम लोगों ने जूम वेबिनार किया था तो वो ऑलरेडी, हाउ ओल्ड इज ही नाउ?
19 months.
19 मंथ्स. तो ऑलरेडी वो जूम में ट्रेनिंग करने लगा है. माइक छीन के बात करता है. माइक छीन के बात करता है. सो दैट्स द इफेक्ट of she doing a lot of training programs and Zoom webinars while she was
Yes,
pregnant.
when I was pregnant also I did your Zoom many times.
एब्सोल्युटली ड्यूरिंग कोविड, उसके मतलब कोविड के टाइम पे से हम लोगों ने काफी जूम वेबिनार किए थे. सो आई थिंक दैट्स रिफ्लेक्टिंग. सो डॉक्टर ने
Yes.
थोड़ा डेमोन्स्ट्रेशन ही दिया हुआ है.
हाँ, तो इट प्रूव्स वॉट एवर आई टोल्ड.
यस.
प्रेगनेंसी में जो करते हैं वो बच्चे में आता है.
And then I've also seen, I told you that, me and my wife were consulting her way back in 2000, I guess 2005 or 6. And it's
हाँ.
almost like
Yes.
18 years. And then I see कि डॉक्टर सुमिता प्रजापति और यंगर बन जा रही है.
Oh, thank you.
So
Ayurveda, obviously.
yeah. So Dr. Alisha Nuran is asking how long doctor is going to stay in Mumbai. Up
2 months.
2 months. So she'll be here in 2 months.
20
Then
जनवरी से 2 महीने के लिए.
yeah, so 20 January से लेके 20th March तक. And when she'll be back to USA, and then she also keeps traveling to a lot of countries, African countries.
लंदन एंड अफ्रीका.
Yes, yes. Okay, great. So Florin ma'am, you want to take an appointment with Dr. Sumita in Mumbai? Yes, okay. So she charges some consultancy fees, and then I'll charge some royalty as
श्योर.
well. Okay. Riswadkar sir का एक question है. You said Ayurveda has no side effects, but few doctors say where there are effects, there are side effects as well.
No, I told if it is given properly.
Absolutely.
If it is given properly, by knowing your imbalance, your prakriti and vikruti, then it will have side benefit. It won't have side effect if it is given properly. Because
इसका एक
Ayurveda believes in individual treatment. It doesn't. It is not common for everyone. So personalize if you are doing proper by proper diagnosis and proper imbalance बताकर फिर उसका करते हैं तो then it will have side benefits.
एब्सोल्युटली, यू सेड इट राइट. मतलब कोई भी चीज इम्बैलेंस होती है, वो आयुर्वेदा हो या कुछ भी हो, तो लाइफ के लिए अच्छा
Yes,
नहीं
side
है.
effect हो सकते हैं if it is not given. If you are a pitta kind of person and if I give you many hot herbs or bhasma, then you will get problems. Acidity हो जाएगी आपको. या काढ़ा और लिक्विड बहुत सारा देंगे, then you will get problems. So all my supplements which I made are all Ghanavatis. I don't use kada and liquid or syrup. वो सब नहीं रखती हूँ. So they don't get any heat related
Yeah, I think
issues.
we have seen this best example in COVID. During COVID, जब लॉकडाउन हो रहा था, तो किसी ने ऐसे जेनरिक सजेशन दिया था कि हल्दी को ज्यादा यूज करो, तो
काढ़ा
लोगों ने
पियो.
काढ़ा पियो, हल्दी ज्यादा यूज करो, तो लोगों ने ऐसे पी लिया कि मतलब कोरोना तो भाग ही गया. और यहाँ पे
अल्सर हो गए कितने लोगों को.
हाँ, अल्सराइटिस हो गए, छाले पड़ गए मुंह पे, बिकॉज
हाँ
एनीथिंग इन
हाँ
एक्सेस.
हाँ, मेरे पास
एनीथिंग.
बहुत सारे आए थे वैसे.
Yeah, yeah. All right. So Gopal Singh, how we can take an appointment? As I said, go to the website. Her number is there. I think she's on WhatsApp, so you can get in touch with her, and she will be there to,
Or they can ask you to give my number. You can give my
Yeah,
number.
I can also send that number to you. And Dr. Alisha is asking, are you going to Mozambique in Africa? I know she's going to Dar es
I
Salaam in
think to
Tanzania.
Tanzania, Dar es
Tanzania.
Salaam
Yeah.
and Monza,
All right. So Dr. Alisha, that's the
Zanzibar.
answer for you. All right, so good. So I'm sure you will be able to get some very, very scientific, personalized advice, and you'll be happy with her treatment. We have Mr. Karthik Vyas, so he's asking what side effects when basma is put in Ayurveda.
See, Ayurveda is not. Ayurveda में भस्म का पूरा एक बुक है, रसशास्त्र. रसशास्त्र explains everything about bhasma. But if the bhasma is cooked properly, उसके इतने सारे संस्कार बताए गए कि हर एक भस्म को, किसी भस्म को गुलाब जल में घोटा जाता है, किसी को इतने सारे घंटों तक जमीन में डालकर उसको पकाया जाता है, ऊर्ध्व गमन, अधोगमन, ऐसे बहुत सारी प्रक्रियाएं बताई गई है। अगर वो प्रक्रिया से प्रॉपर अगर भस्म बना होगा तो वो अमृत का काम करता है। बट नाउअडेज nobody has that much time to make that भस्म properly. अगर वो पूरा टाइम देकर वो भस्म को बराबर नहीं पकाया गया है तो देन देर आर सर्टन केसेस विच हैव हाई क्रिएटिनिन या किडनी प्रॉब्लम या एसिडिटी, गैस, ये सब प्रॉब्लम होते हैं। सो वेन एवर यू वॉन्ट टू हैव भस्म, मेक श्योर इट इज प्रॉपरली मेड और एकदम जेन्यून और अच्छा क्वालिटी का भस्म है।
Okay. I'm sure, Karthik Vyas sir, you must have got your answer. So I guess the formulations and preparation of each supplement, whether it's in Ayurveda or any other form of medicine, is important. अगर वो प्रोसीजर नहीं फॉलो किया है तो ऑब्वियसली जो एक आइडियलिस्टिक सजेशन रिकमेंडेशंस ऑफ एनी थेरेपी जो है, आई थिंक इट कैन गो रॉन्ग. Sucheta ma'am asking, is there any natural remedies for hair loss and hair thinning? I think Sucheta ma'am is quite impressed with the photographs and testimonies that you've shown.
See, the hair problems are always connected with pitta according to Ayurveda. So when you have lots of heat in your system, too much fire, pitta will always damage your skin, hair, and vision. These three things will have problem. So hair problem, then vision problem like eyeglasses or cataract, glaucoma, then skin problem, the skin dullness of the skin or dryness of the skin or sagging, or all these problems are connected with pitta imbalance. So what we do, we try to balance out the pitta by following pitta diet, pitta lifestyle, and pitta herbs. And there are
All right.
certain herbs or the combination of plant extract which gives you new hair growth.
All right.
So I
So,
have so many people, they started getting like after delivery, I lost almost half of my hairs because after delivery, all the hormones they start to change. And then immediately I started my supplements and I started to get the new hairs and all the hairs are back again. So
all
you
right.
have to follow pitta diet, pitta lifestyle, and pitta herbs. You can check all these in detail on my website.
All right. So, thank you
It
so
can help
much.
you. Only
Thank you so
one
much.
remedy is not there. You have to do it everything properly.
Okay,
Otherwise,
I'm sure Dr. Sumita enjoys giving a lot of recommendations without any conditions. But I think two things that we need to take in consideration. One, of course, it's 9:30, so we need to wind this up. Second, you need to keep some questions and your your queries to the consultation that you will be doing when you go up. Don't ask everything now, so that she needs to get paid for her consultation when you visit her.
that's
So
okay.
so, thank you so much on behalf of everybody who is here. I see most of the people have stayed back in spite of it being 9:30. And thank you so much for a very elaborate session. And I'm sure you will definitely be there whenever we ask you to do a session,
Sure.
even some later part of 2020. I mean early part of 2024. So thank you so much.
Thank
सबके
you.
तरफ से मैं धन्यवाद देना चाहता हूँ आपको.
Thank
So
you. Thank you.
so that was Dr. Sumita Prajapati. So this was a session on Ayurveda and Ayurveda का प्रकृति के ऊपर किस तरीके से आप personalized diet ले सकते हैं. Just imagine that let's say sometime later we have a session on homeopathy and वहाँ के जो expert, जो homeopathy के जो expert है, वो जब बोलेंगे आपको लगता है कि ये भी पूरा सही है. Then you have somebody who is doing another alternative therapy. But I think what is something that we all need to take into consideration is that all therapies or systems of medicine are there to give solutions to people and then make them healthier, happier, and live longer. So you have to approach probably a integrated way of medicine. And as Dr. Sumita Prajapati said, जो मॉडर्न टेक्नोलॉजी के जो डायग्नोसिस हैं उसको यूज करके नेचुरल लाइफस्टाइल और नेचुरल फूड्स को जो हमारे एंशियंट विजडम ने लिखा है उसको अगर यूज करते हैं, एंड आई थिंक दैट विजडम वी ऑल नीड टू हैव टू सी व्हाट इज गुड फॉर अस, गुड फॉर मी, एंड उसको कंबाइन करेंगे एंड वो अवेयरनेस हमको आएगा. I think then we will definitely be living healthy, happy, longer, and happier. So, with this, we come to the end of this program. Velocity Genetics will bring these kind of webinars to you absolutely free of cost as a commitment to spread genomic wellness awareness. And you saw कि आयुर्वेदा की जो प्रकृति है is exactly what we see, that genetic आपका makeup क्या है. So based on that, we'll give you recommendations. She also mentioned that wheat is mentioned throughout the Ayurveda scripts, but वहां पे मॉडर्न वीट के बारे में नहीं लिखा है. और मॉडर्न वीट अभी तो पेस्टिसाइड्स एंड पता नहीं कमर्शियली कैसे उसको उगाते हैं, और इसकी वजह से दैट इज नाउ क्रिएटिंग a protein called gluten, which is the human DNA does not recognize, and digestion and the microbiome gut goes for a toss, and you have all related symptoms. So that's why we need to be careful of combining all the wisdom of all the medicine systems and see what's best for you. So thank you so much for logging in and being here for so long. We will see you on next Thursday with another webinar. This time we actually had to do it on a Monday for some availability issues and some adjustment. And then I really want to thank Dr. Sumita Prajapati once again. She has to take care of her young son of 19 months. She has to also take care of so many other things. But in spite of that, she's making time early in the morning. It's just around 10:30 there. And we'll look forward to see you in India very, very soon. So thank you very much. Goodbye and good night.